Epilepsy. November is National Epilepsy Awareness Month. What is epilepsy? Epilepsy, also known as a seizure disorder, is a brain condition that causes recurring seizures, which results from bursts of electrical activity in the brain. There are many types of epilepsy. In some people, the cause can be identified. In others, the cause is not known. Epilepsy is diagnosed if a person has at least 2 unprovoked seizures at least 24 hours apart. According to the Centers for Disease Control and Prevention, epilepsy affects an estimated 1.2% of people in the United States. Epilepsy affects people of all genders, races, ethnic backgrounds, and ages. Epilepsy is not contagious. You simply can't catch epilepsy from another person. In approximately 50% of people with epilepsy, there is no identifiable cause. In the other 50% with epilepsy, there are factors such as age, brain tumors, genetic influence, head trauma, infections, intrauterine injury, developmental conditions, and stroke, which is a leading cause of epilepsy. Risk factors for epilepsy include age, onset most common in children and older adults, but it can occur at any age, Alzheimer's disease, autism, brain infections, cerebral palsy, dementia, family history, head injuries, seizures in childhood, and stroke or traumatic brain injury, and other vascular diseases. The diagnosis of epilepsy is usually through obtaining a patient history, through an EEG or electroencephalogram, and an MRI. Complications associated with epilepsy include drowning, car accidents, falling, insomnia, loss of memory, and pregnancy complications. Other rare complications include status epilepticus and sudden unexpected death in epilepsy, or SUDEP. Treatment for epilepsy include medications, surgical removal of a small part of the brain causing the seizure, procedures to put a small electrical device inside the body that can help control seizures, and possible specialized diets. Also, avoidance of seizure triggers if known, and occasionally seizures may spontaneously stop on their own. What to do if you witness a seizure. Do not restrain the person having the seizure. Do not attempt to force something into the person's mouth to prevent injury. Turn the person on their side, stay with the person, and time the length of the duration of the seizure. Also, call 911 if the seizure lasts longer than 5 minutes, or if there are repeated seizures. If the patient has diabetes, consider testing the blood glucose or sugar level. Thank you for watching. Find me on all social media platforms. Be sure to follow, like, and share. I am Nurse Master Charlie.